I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Our guest today is Shelly Chandler. Welcome, Shelly.
Thank you very much.
So, Shelly, I always like to start off with, how did you get into this field of supports and services and health for people with intellectual and developmental disabilities?
It goes back to my dad, actually. My dad was an elementary school principal, and in the 60s and 70s, probably 60s, he was one of the first ones to begin a special education program on the school property. So we grew up working with individuals and engaging with individuals with intellectual and developmental disabilities. It was just part of our family, part of who we were, part of what we did, and got very excited about it.
So where are you now in this field? Or maybe we should start with, where have I been in this field? Right. And then we can talk about where you are now.
Okay.
All right.
Well, I grew up in Iowa. I watched what was happening with my parents. I knew I did not want to teach. So after I graduated from college, I went out to Boston to get my master's degree in rehab counseling, ended up working for a sheltered workshop, and never looked back. So I worked for a workshop, and then I worked as a voc rehab counselor for a few years. I helped start the first supported employment program for people with traumatic brain injuries in Massachusetts. And gradually, I was called back to Iowa to help raise my children and ran a couple of provider organizations, one in specific to IDD and another in mental health. So I was a provider for 25 years, and then I moved into association management and ran the Iowa Association of Community Providers for 17 years. I retired from that work in June.
Recently?
On June 30th, and shortly thereafter, I contracted with a couple of groups. I am here today representing as a consultant Molina Healthcare. I also am working with Stacy DiStefano, who is with Consulting for Human Services. So even though I've retired officially, I'm retired-ish, it just never leaves your heart.
I was about to say, it's hard to get away from a field that you really like it.
I am very, very passionate about this field.
And when you said you're here today, just to let everybody know, we're coming to you from the Kansas InterHab Conference, which is a Kansas state provider organization.
Yes.
So it's great to be here with you and everyone else here at this conference. And then the other thing I want to go back, as you said in the beginning, what'd you say? You knew where you were early on in this field. And that's kind of one of the things that I think a lot of us experience. I fell into this field, just I had no experience in the field, fell into it. But it didn't take long before I'm like, okay, this is where I want to spend the rest of my career. And one of the reasons we do this podcast is to help people out there see this field as a place where you can have a very rewarding and fulfilling career.
40 years so far.
Yeah, there you go. There you go. So interesting. So you're consulting now, and I know you've worked with a lot of different aspects of supports and services for people with IDD as a provider, and you have to address all of the different issues. Tell me some experiences related to healthcare, health supports and services for people with IDD in your various roles.
Certainly. Well, I think that one of the things specifically regarding healthcare that's critical is that much of the focus of services and supports is helping people be fully integrated in the community. And part of that is participating in activities in the community, going to the Y, belonging to your church, synagogue, mosque, engaging not separately, but part of the community. And that means going to the doctor and going to the dentist and following up. And it also means that those healthcare providers, the doctors, the dentist, understand the nature of individuals with intellectual and developmental disabilities. Why I'm drawn to this is because when you see people being given the opportunity to live and work and play in their community, they thrive. It is all the things that we expect to do every day. And it's just a wonderful thing to watch someone who has not previously been given those opportunities, including healthcare.
Sure.
Healthcare, being provided with that and watching them fly.
Yeah, and that healthcare aspect is, really my world and my little piece of what I call the big diamond of community integration, and that's one of the things that can sometimes be challenging, because and myself included, I didn't have the education and training related to providing healthcare for people with IDD. I learned about some of the specific conditions and the genetic conditions, but that's very different than actually providing healthcare and understanding how people with intellectual and developmental disabilities may have, we all have this often the same health conditions, but they may look very differently. They may present very differently, especially in people who don't use words to communicate. And excuse me, one of the things I like to point out, because it's so important to understand, is that people who don't use words to communicate still communicate.
Absolutely.
And many times it's because, or many times there might be an adverse behavior, as we often call them, but that may be really be a form of the person communicating that they're hurting, they're in pain, that something's going on. They just can't describe it. And that's where I think the training of healthcare providers and supporters of all levels need to be able to recognize the different presentations of these common conditions so that we can act on them early and have people have the opportunity to have equitable health care.
So one of the things that recently, my daughter was not feeling good. She was very busy. She flies all over the country for her job. And she was starting to not feel good, but she was pushing through because, work.
Yep.
Until her body finally said enough is enough. Now, she didn't have a behavior, but her body kind of fell apart and she needed to rest. So you gave the perfect example of an individual with a developmental disability who can't describe that, but their body continues to tell them we're not right. Yeah. As providers, I think that we often don't communicate well with the healthcare professionals. And healthcare professionals don't often try to put themselves in the role of a social service provider either. So it's two different languages, and now you have a third, not using words necessarily to communicate, and trying to bring those three systems together is the dance that's really critically important for ultimate health for those individuals with developmental disabilities.
You described that beautifully, and I want to say that I appreciate your comment about maybe sometimes the supporters don't communicate in the best way either when it comes to healthcare visits, and that can be part of the challenge. I sometimes talk about reasons people, when I was practicing, people were brought to see me, and the supporter who was with them says, well, he's just not acting right.
Right.
And I'm sitting here saying, okay, I don't know exactly what that means. What does acting right look like, first of all?
Right.
And then what is he doing that's not, quote, acting right? It's like, being able to provide, information such as this is the baseline of this person. This is what he usually does. This is what he usually likes. These are activities. This is how he interacts. And this is how he's different. And this is how long it's been going on. So all of us communicating is extremely important, and communicating in a way that helps each of us, including the person with disabilities, and being able to recognize their language.
Three different languages happening.
Yep.
Yes.
You're exactly right.
Yes.
So in your work in this field now, how does it relate to maybe some of what we've been talking about?
So the work that I'm doing now is really helping to bridge those three worlds with a fourth, which is insurance companies. And we often, as providers in the world of long-term service and supports, home and community-based services, and others, we have our own set of language. The healthcare world, physicians, therapists, et cetera, have a different language. Insurance companies have a very different language. So my world, they collided when managed care came to Iowa, now 6-7 years ago. And being in Kansas, managed care has been in Kansas for 8 years. And that collision and not understanding the language really resulted in dramatic and quite unfortunate healthcare outcomes for many, many people with intellectual and developmental disabilities. And my passion grew as a result because now we have to learn a fourth language. And most importantly, getting the insurance companies, those health plans, managed care organizations, managed care plans, to understand the language not only of Kansas, of Iowa, of every other state, but the language of physicians, the language of social service providers, and the language of those individuals, their patients that they are supporting and insuring. So my role with Molina is really having them understand our world for the benefit, ultimately, of those individuals to live a healthy life.
Sounds really simple.
It's not rocket science.
I was.
But it takes a lot of. They just got to keep going.
I was totally joking. That's. There's a lot there. Yeah, a lot to do for sure.
Indeed.
So.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
One of the things that I always like to challenge guests with is to tell the audience. I usually say three things in 3 minutes, three tips, 3 words of wisdom, 3 pieces of advice that you think listeners out there could benefit from in terms of what can be done to improve supports and services or health for people with intellectual and developmental disabilities.
All right, this may take more than 3 minutes,
No
so
problem.
bear with me.
I used to use a little timer, but I don't anymore.
Okay, thank you. There's nothing on the table. Well, first, I would say that people with intellectual and developmental disabilities really have the same goals and desires for healthy life as a person without an intellectual and developmental disabilities. We have more in common with the world than is different. And I think as professionals, oftentimes the most important thing is taking off your professional hat and just being a human, and understanding that we have things to learn from those that we are supporting. So that's number one.
That's excellent. And I think one of the keys there is recognizing that we have more in common
100%.
than the differences, really.
That's right.
Yeah.
So as the relationship with a healthcare provider and a social service provider, keeping that commonality, being willing to listen and understand a different language, bringing in the patient, the client, the member, the consumer, and their family, and understanding what is most important to them. Again, being willing to take off my professional hat and listen and learn. And finding that common goal is critically important. And then finally, and probably most importantly, having just retired from a 17-year career within association management, it is most important for everyone watching and listening that they are relentless in their pursuit, because at the end of the day, the only thing that is important is that person, that individual with intellectual and developmental disabilities, is being given the opportunity, every opportunity that all Americans, all of us in the world, expect to have every day.
And that ties to something I say frequently in terms of healthcare specifically, is kind of my vision or my goal is to have a place where any person with any level of disability or non-disability can present themselves to some healthcare setting like a hospital or a clinician's office and receive a competent, compassionate, just basic competent, compassionate level of healthcare.
It's not that hard.
It's perfect. Yeah, it's not that hard, really. When you really think about it, it's not, and it shouldn't be that hard.
Yes.
Anything else you'd like to?
It's worth the effort.
That's for sure.
Be relentless.
Yes. Anything else you'd like to chat about?
Oh, I could talk all day.
Well, maybe we'll save it for another visit. How about
Fantastic.
that? Shelly, thank you so much for joining me today, and more importantly, for the incredible work that you have done and that you're continuing to do in this field.
It's my great honor. Thank you.